to get through. All right. At the end, you'll have to wait if you have a question to answer them. All right.
Okay.
So I'm going to record this discussion if you don't mind.
Okay.
All right.
And if you don't mind, I'm going to do the same thing.
There you are.
And I apologize. The reason I'm doing that is because
That's okay.
the last guy,
No, that's all right. Doesn't matter what the reasons are.
he pencil whipped it. And I wish I had, because what he said and what was on the tape, or would have
What's
been
the
on it,
different thing? It's just good that if you're going to record something, you should tell the person.
well, yeah.
That's just good.
That was my next thing. You picked up your phone. I figured I'd wait till you.
Don't worry about it. Okay,
Okay.
so here's what I have. On January 31st, you were at work, and then what I have is you fell down some steps. Is that about right?
I fell up the steps. Going up the steps, I rolled my ankle and fell going up.
You fell up the steps.
Yeah.
Okay. What exactly were you doing though?
I was going into work,
Uh-huh.
and I hit the bottom step, and it.
Okay. Hit the bottom step and fell. So you were seen at Baylor Regional Medical Center at Grapevine,
Yes, sir.
and you were diagnosed with a right ankle sprain. You had an X-ray done, it was negative,
Mhm.
and you were told to follow up with a doctor at some point. Is that correct?
Actually, they took me to Baylor the first thing that morning when my supervisor got
That's
there.
what I mean, Baylor Grapevine. That's what I'm talking about. You went to Baylor Grapevine.
Yeah, that's what I'm
Did you
saying.
get
And
X-rays?
then after that, whenever as Care Now opened up, then I went to Care Now that day.
Let me ask you. You actually went to Baylor Grapevine,
Yes.
and they got X-rays, and they said you had a sprain, and then they discharged you. Is that about right?
Yeah, they said that the X-rays. They said that there was so much swelling that they couldn't tell if there was anything broken in there or not because of the.
No, the X-ray reading I have it here. It says there's nothing broken.
Well, I know. I'm just saying, as far as the X-rays, that's what the guy said to me that came in.
Okay. No, the X-ray I have the X-ray reading.
No. There's nothing broken. I'm just saying that's what he told me.
Okay, because swelling's got nothing to do with breaking. You can tell if something's broken whether it's swollen or not.
He said that it was the swelling actually clouds up the X-ray, is what I'm getting at. That's what the doctor told me.
So a doctor told you that?
Yeah, at Baylor.
Okay. Okay.
I'm just passing off what he
No,
said to me,
I'll
but I
just-
know it's not broken. I know that there was a
No, I
big-
just said the doctors told you that because of the swelling, you couldn't tell if it was broken.
Yeah.
Okay.
Now, when they did X-rays on me, as the swelling began to go down or whatever, they could see that there was no break in it or whatever. When they did the MRI on it, they said. that
Let's
there
go.
was
Let's go in a chronological fashion. So
Sure.
you were not seen at KNL that day. You were seen at KNL on February the 1st. That's the record I have.
I was under the impression that I went that day, but
Uh,
after I left work that day,
I guess I'll just put down, I'm just telling you what I'm going to put down.
no, that's fine.
The record I have says you went away, I assume went home, but the next day you went to KNL and you were diagnosed with an ankle sprain and they gave you a boot, a fractured boot. You followed up with them in the 7th and several days, and then you were seen again in March. At that point they felt you were not progressing and you were sent to get an MRI. On March 5th you had an MRI of the right ankle and they said you had essentially an ankle sprain. It's called an ATFL tear.
Mhm.
At that point, it's not very clear when, but at some point you had been complaining of bilateral wrist pain as well. The KNR doctor records it, but nothing more is said of that. At some point as well, he talks about left and right knee pain. And it's not clear what he wanted to do beyond, I'm not sure. You know, sometimes the records are illegible, sometimes they just put down complaints of knee pain. In any case, April 19th, you had an MRI of the left knee. He showed you had what you call chondromalacia, which means there was an injury to the cartilage, but no other pathology. You aware of that?
Yeah, I actually have copies of that.
No, I'm just wondering, are you aware that that's what it said, that you had cartilage injury and no other?
Yeah, and it's actually both knees. It doesn't say it on there. I'm assuming you got those records from Dr. Craig Saunders. Dr. Craig Saunders, whenever he first X-rayed my knee, when he first copied the stuff for it, he only copied the right one, and if he'd have looked behind it, there was actually a left knee.
Actually, I have
A right knee as well, excuse me,
Okay. So you had an MRI of the right knee.
and the left knee.
Okay. Do you remember the date, or do you have that there handy or something?
I believe this is the one from then, 419 of 11.
Yes.
MR of right knee and of the left knee.
You do have MRIs of both knees.
Oh yeah.
Can I just look at that?
Sure.
So this is MRI of the right knee,
Mm-hmm.
April 19th. I don't have that. I have the left knee only. So actually that's information I don't have. So right knee MRI. You're doing on the right knee MRI, it shows about the same thing. Are those for me or?
That's all my records if you want to look at them.
No, I can't look at them at this point. What you can do,
This is as of about a month and a half ago. I've been to the doctor since then, so there'll be a little more.
okay. Let me keep this for now. I guess let's go through what I have and then we'll try to figure out what we're gonna do about records because these are the records I have.
Okay. Yeah, I saw that. That's,
All
but
right.
that's mighty thin, so.
Yeah. So from May to August, this is after the MRIs of their knees. From May to August, you followed up with care now. Most of their notes, they just say you followed up and you still had some pain and they did physical therapy. Is that about right? From about May to August of 2011?
Okay, and I'll be real brief here with you.
Please.
They sent me through, I had to beg for the MRI. I had to get in touch with their manager in order to get the MRI to show that there was actually damage to my knees because they weren't doing anything about either one of them. Okay, the physical therapy came later on after I went and saw Dr. Craig Saunders. He sent me to, I believe it was Harris Methodist, something, their medical thing. It was in downtown Fort Worth. I can't remember if it was Harris or what.
Okay.
They had given me 10 sessions of physical therapy. I actually have the prescription from Dr. Craig Saunders for what he wanted done. The BAPS board is one of the things he wanted to do for my ankle. 4 to 5 times out of the 10, they actually used it. Other than that, they pretty much did their own thing. It was a wash, basically. They didn't really do what they were supposed to. No, there was not any progression from that. And then they sent me through work hardening or whatever. And of course, with the injuries not being treated, there was not much progression there at all. Does that answer your question?
No. I was wondering how much therapy you had from May to August 2011.
That would be, I would assume that therapy fell in there. That would be 10 sessions of physical therapy with those folks over there, but they...
So approximately 10 sessions?
Yeah.
About 10 sessions. Okay. Great. And then, you saw Dr. Sanders on or about June 30th. Oh, that's what I have. I know the dates are difficult to remember, but that's what I have. On June 30th, Dr. Sanders, and he recommended conservative treatment. You saw him again August 25th, and he said he did not have any surgery recommendations. And his note, he says that he feels that essentially the MRI showed degenerative changes. That's what his
What does that mean?
That there are changes that are not caused by trauma, that they're caused by wear and tear.
Okay. Those notes were done by his secretary, and I actually had him recorded saying something completely different.
Okay.
Every time I went into his office, he talked about doing surgery.
Okay.
So what his nurse was writing down was completely different.
So he's not saying something very different. Okay.
Uh-huh. But I have it recorded.
Okay.
And actually, I have him saying where the doctor at the physical therapy place said that he said it was an old injury, and Dr. Craig Saunders in the video says, "Bull crap." He goes, "It's a fresh cut." In other words, it wasn't an old injury. It wasn't. I don't know if that's what you're talking about or whatever. The doctor, at that health place or whatever, the physical therapy place was saying that it was an old injury, and he was saying, no, it's not. And it was so long after the injury or whatever, he was saying that, of course, it's going to show some difference. He goes, but it would be frayed if it was old, and this is cut.
Okay.
The unfortunate thing is that they've only given you partial notes there.
Right.
Yeah, so you don't even have the fact that I've actually had an MRI arthrogram on my left knee, and that it showed way more damage in there than that. And that's why they've done surgery on my left knee.
Yeah, I have, let me tell you what I have, and then what I can do then is if you have that, we'll have them copy it and I'll review that before I do the report.
Okay.
That'll be the, so interpreting the other functional capacity or this is a test to see what you can do.
The FCE.
Yeah, FCE, and it said that you could not go back to work full time, full duty.
Yes, sir.
So November 8th, you had an MRI of the right ankle, which confirmed that you still had a sprain, which is an ATFL tear. On December 2nd, you saw Dr. Guiden, who said he wasn't sure that there was any surgical problem with your ankle, but recommended to see a foot and ankle specialist. You saw somebody else to see if you had an exam just similar to this, to see if anything else needs to be done, and he felt that there were things that need to be evaluated, like your knees and so on. So in January, you got a right ankle arthrogram,
Uh-huh.
which was negative for anatomic problem.
Okay, and I actually have that. I can play that for you if you wanted to. The doctor that I've been seeing is Texas Bone and Joint down here.
Dr. Chaplin.
Yeah, Dr. Chabda, and Rudy in his office, he said, this is normal, and he goes, it's connected like this. So
What is he talking about?
the ligament in there where you're talking about that,
It's called the ATFL?
yeah.
Yeah,
Well, there was actually 3 ligaments torn in there.
yeah.
Okay, but anyways, he's saying, he goes, it's,
You do know the arthrogram doesn't show those ligaments, it shows the inside of the knee, of the joint.
well, according to what Rudy was saying or whatever, he went
And
over,
who's Rudy again?
he's in Dr. Chabda's office.
But he's not your doctor, right?
Actually, he's the one that I had seen up there mostly. Until recently, I've actually, Dr. Chabda usually has other patients that he's doing.
Right.
Rudy is the one that comes in and sees me usually there.
Rudy sees.
He's inside of
Okay.
Dr. Chabda's office.
Somebody there says the ligaments Okay, the arthrogram shows that there was no significant anatomic pathology. You had a designated doctor evaluation April 23rd, and this is where my notes essentially
Yes, sir.
get limited.
Yeah.
What,
Okay, I'll tell you real quick because your notes stop right there. I'll tell you real quick.
yeah,
Your, it says right here on yours that it shows no.
it's the ankle,
Yeah.
Yeah, the arthrogram essentially,
This right here is for surgery for my ankle
yes,
because I went and saw a specialist for my ankle.
okay,
And as soon as my knee heals, they're going to do surgery on my ankle
okay,
because that doctor looked at it, reviewed it further than whoever it was that reviewed this.
yes,
They just, it's almost as if they just kind of skimmed over it because Dr. Chabda's office sent me to this guy over here,
who's that?
and I'll tell you, Dr. John Novak over in Dallas at the Foot and Ankle Restoration Center.
Okay,
Uh,
what kind of doctor is he?
Foot and ankle specialist.
Like an MD or?
Yeah,
chiropractor?
he's the one that's going to be doing that. No, not chiropractor. Indeed, Dr. Novak.
Dr. Noah, okay. Oh, you know it, okay.
Yeah, that's what I'm saying. So this is the, basically they said whenever it gets approved, here's your information, you call us or whatever, we'll schedule the surgery for the
So-
next day available.
Okay, so in summary, you had a surgery by Dr. Chabda. Do you remember what date was that?
August 20th.
Yeah, oh, that's better.
Yes, sir.
And what did he exactly do? Did he tell you?
I don't know where it says in here what he did, but here's the,
You have the pictures? Great.
they scoped it. I know he did that. It had something to do with my MCL, my meniscus and cartilage torn, but I don't know what, I mean, just orthoscopic surgery. I don't know what the actual, I know there's words that they use, but I don't know exactly. And that was August 20th of this year, after, what, a year and a half?
Okay.
I think, a year and a half, something like that. A little better.
All right, thanks a lot. So, just give me a second, I need to see if this can be... Oh, we'll be out in a second. All right, so here's what we're gonna do.
And then, I don't know if you need this or not. This is when we can, I'm sorry. This is whenever, because I had to contest the MRI, or MMI.
Okay.
And this is Dr. Chavda's notes on it. My last time going into Dr. Chavda's office, he's spoken of doing surgery on my right knee as well.
You did?
Yeah, but these are the notes. I mean, he was answering her questions and what have you. I don't know if you need these or not.
What do we
Or
do?
would like to-
I guess we could. Here's what seems to have happened. We did not get a single note from Dr. Chavda. So what we'll do is we'll get them, and I'll review them, and I'll tell you what I'll just be fair and try to give an opinion what I think.
Okay.
The point of the exam, like I said at the beginning, is to get someone who's impartial, who's not involved in your care, who's not involved, who doesn't benefit from any direction. So I'll review those
I
records,
appreciate that.
and I'll review that. But what I can do is examine your knees and your ankle. So it's your right knee, left knee, and right ankle. Is that about right? Okay.
Right knee and ankle, and left
And
knee.
left knee. Great. So since that has a brace, we can start with the right knee since it's closer.
Okay.
All right. Can you bend the knee as far as you can?
Straight.
No, just bend, bend as far as you can.
That hurts.
Can you straighten it out?
I can straighten it out.
Great. Okay, I'm just going to test for stability now. If anything I do cause you any pain, just tell me to stop. I'm not trying to cause you pain.
No,
If
I
it hurts, we'll stop. All right, great.
That hurts my ankle.
It hurts your ankle, okay, but not your knee. That hurts your knee?
Yeah, I can.
Okay. Straighten the knee again, will you? Okay. No, don't hold my hand.
No, I'm doing that so you understand, because that last guy said that there was no crepitus in there, and there is. Can you feel it?
It's a clunk, but I don't think that's not crepitus.
Well, no, I mean, can you feel the, no, he was talking about this one when he said it, but there is something in there. Can you feel it?
I don't feel anything abnormal. I don't know what you want me to feel.
It's
Really,
usually
that's-
smooth and you can feel,
No, there's a small shift, but if you examine 20 knees, about 10 of them will have that. That's not a sign of pathology.
okay.
Okay, all right. Crepitus, there's something called crepitus in specific.
Well, that's what I said. He was more referring
Okay.
to, but you can feel something, and here's what I'm getting at.
Yeah, but I'm not going to record that as something
No, no.
pathologic. I just want to let you know.
No, it's fine, it's fine.
Okay.
We're not to this one yet.
Okay. That hurt you?
It doesn't feel good pushing it over now. More you pushing it on the inside like that.
Okay. All right. That bother you?
That right there? No, not as much.
Okay. Is there a way to look at the ankle?
Sure. Sure. And I apologize for referring back to that guy so much. It just aggravated me because it was almost as if he was going for somebody's side.
No, doctors are human. Sometimes we have other things in our mind, or trying to do this, trying to do that. And as you can imagine, you said you work for American or something? American. Yeah, in the service industry, sometimes you meet somebody who's missed his lunch or something. And
There was only 2 guys, and I was the first guy for the day.
that hurt you?
He doesn't feel very good.
Can you turn the foot like this? Yes, you can, actually. Okay, turn the foot in again. Okay, and turn the other way. Wait.
Are you gonna go against the other one?
What's that?
Are you gonna measure it against the other one?
No. Can you bring the foot up?
I was gonna say, because the other one will go a lot further than that.
Well, what we do have is, I'll tell you what. Can you go down? What I was going to say is, it's essential within normal limits, so whatever the other one is, it wouldn't change the opinion. If this was low, then I would say we need to find what the other one said.
Well, no, that's what I'm saying. I mean, this one won't bend near as much as the other. The other one I can pretty much point straight out. This one won't do that. And they haven't done surgery on it yet either to figure out whether or not there is any
Okay.
inhibited, if it's been inhibited. You know what I'm saying?
I don't think surgery does that, but you can have surgery. on
No,
your-
I'm saying. I mean, I don't know if it is going to or not. Hopefully it's going to fix everything.
Hey, you can have surgery on anything you want, Chief. I don't know. The studies and so on suggest that you had an ankle sprain, and the classic teaching on that is absolutely no intervention beyond physical therapy. But
Well, see, they said ankle sprain, but it was a complete tear
of the ATFL,
of all 3. I mean, I've got pictures of it where he shows through there.
okay. Hey, you can have surgery. Don't worry, man. I won't stop you.
No,
If
it's
you-
not that. It's just, what I'm getting at is after the surgery, is there gonna be more hindrance to keep it from, I don't know. Either way, I'm just talking.
It's all right, dude.
Did you need my shoe off there anymore?
No, I'm done. I was just giving you some time to put that on.
Okay.
Is there any way we can take that brace off?
Yeah, I'm just trying to get situated here. I'm sorry, I got my stuff spread out there.
And the surgery was August 20th, correct?
Yes, sir.
August 20th, 2 months ago. Can you bend the knee?
I can.
All right. And can you straighten it out?
Now, just for the sake of showing you,
Mm-hmm.
that's how far I can straighten it out compared to the other one.
But he just had surgery.
Yeah, I'm just saying, look at that. That's
Yeah.
and that hurts. It hurts on the inside of my knee.
All right. Relax for a second. You feel me touching you?
Mhm.
But same both sides?
Mhm.
Same both sides?
Mhm.
Same both sides?
Yes, sir.
Same in there?
Yes, sir.
Okay. Can you straighten any out? Ben?
No.
Okay. Well, that's all I need to do.
Did you feel it in there?
I didn't feel anything, Chief. I don't know what you want me to feel. You want me to feel something? Okay.
I can feel it through your hand.
Okay, I don't want you to be surprised. I'm not going to say this crepitus. I will
Every
not.
other doctor says that.
I don't know what they're talking about. I really do not know.
Basically, where the cartilage and everything is torn up, or there's loose cartilage in there, and you can feel it grinding around. Or,
Yeah.
but it's not so much that it's obviously they cleaned everything up, but you can still feel it in there. It was way worse before. In other words, you can somewhat hear it before. If I did that, you could hear.
But I just wanted to be aware that I'm not going to say you have crepitus because I don't feel it.
You don't feel anything in there?
I don't feel abnormal crepitus. No, I don't. That was the point of the surgery, right?
Well, yeah, I'm just saying. I mean, I can feel something in there. It feels better than it did before. The knee feels better than it did before, but
I'll tell you what, I do examine knees all day long, and I do surgery for a living, and I am sensitive to crepitus, but I would not call that crepitus. I really wouldn't.
no. I'm saying I can feel something in there. I asked, did you feel it? I said there was crepitus, and the doctor that did the report before
Yes.
said that there was no crepitus. However, there was. I'm saying, can you feel what's in there now? You can still feel it, in other words. It doesn't feel
So you're
normal.
saying there's crepitus now?
No. I said,
So we're in agreement. There's no crepitus.
yeah.
Okay.
I was just
Good.
asking, could you feel it? That's all I asked. I said, can you feel that?
But there's none.
No, you can feel something in there is what I'm
There's
saying.
nothing abnormal in there. I can't feel anything abnormal.
Okay. Well, I mean, I'm just saying.
No, I just wanted to be aware, but I cannot make things up.
No, I'm not asking you to make it up. I'm just
Yeah.
saying it feels different than this one does. Definitely.
It feels different, yeah.
Okay, that's all. That's all I was asking. Can you feel
Oh,
it in there?
okay, it feels different, but...
Yeah. I'm not saying there's crepitus in there now. I'm saying there was before.
Okay.
But it does feel better than it did. I mean, he cleaned it up really well inside.
Okay. All right, well,
I don't want you to falsify it. I want you to be as honest as possible on that thing.
here's what the next step is.
Now, are they going to have me come back to you once they do the surgery so that you can reevaluate it and everything?
I would
Not
wait till
this.
I would wait till you get back.
No.
I'll tell you what I'm going to say. I'm going to say based on what I find is, I'm not sure. I think I need to see the notes before we make any conclusions. I can't conclude until I see some of those notes. So I think what we should do is copy those notes, and I'll review them, and then they probably will send you to me. But you know the way the system works, sometimes sometimes you, the injured worker, might say you didn't like me for some reason, and then
No,
don't worry, don't. No, I'm not pushing you. I'm just saying sometimes people do, and they get somebody else, which is okay too.
Yeah.
And sometimes it's okay to disagree with what the designated doctor says.
Yeah.
So do you have any questions though? The next step for you, the questions asked were MMI and impairment rating. Obviously, I can only answer those after I see what exactly Dr. Chabda has been doing, and then
Sure.
we'll let you know. You get a copy of the report. Another copy goes to I think the insurer and I think your employer, and that's the short story.
What do you need to see from me? And I'll pull it out here for you.
The one thing I need to...
Did you get a copy of that, by the way, the right knee?
I wrote down what it says, but it'll be good to get a copy of it.
Okay, there you go.
Okay, but past
We'll
medical
set that
history, just so summary. Past medical history, anything I need to know? You have had any injuries or any trauma, diabetes, or any condition?
Well, I'll tell you like I told the other doctor.
Yeah.
I did this when I was 10 years old. There was a little bitty cut. Now you got to remember, now I'm about 2 feet taller, so the scar stretched. It was a little bitty scar. He wrote down it was a sports injury. It is not a sports injury. I just cut my knee open when I was a little kid.
Okay.
It was just a flesh wound.
Don't get so defensive, Chief.
No,
I want
it's nothing against you,
no,
man.
I want to help you, Chief.
Okay.
When we ask questions,
Mhm.
and I know sometimes doctors say something and you might feel he said sports, it wasn't. I don't think he was trying to do anything. I don't know who that guy was. He may not be, I don't think he was trying to do anything. But when you say I was doing something and then I got cut, typically we say it's sports injury. We don't mean to offend anybody or only put it anyway. It just means you had an injury on the knee.
Right.
It doesn't say anything about you, so don't worry. I would not get very defensive. Don't worry too much about what exactly he tried to mean. Well, of course, if somebody says something that definitely wasn't true, that you should correct. But you remember, we are human, and the system knows that the doctors who do this are human. So sometimes you tell me something and I actually hear something else. And that's what I write down. And that can happen. I know you used to work at an American or something. I'm sure there are times when you were told something and you heard something else.
Yeah.
And you know.
No, I'm not defensive against you, man. As I told Julie, I said, I just want to make sure I get a fair shake, because that last guy, he really did write down a bunch of stuff that it wasn't true. You know?
Wasn't true. Do you take any medicines?
Now, the medications that they prescribed to me, hydrocodone and
Yes.
Mobic or meloxicam, same thing. That's what they've been.
Okay, nothing else?
That's it.
Are you left or right-handed?
Right-handed.
And when did you last work?
My last, I could be off by a couple of days. Somewhere in the middle of April
Maybe a
last
month.
year.
April, yeah, I don't want,
Yeah.
no.
Because I don't remember.
Don't worry, I'm not going to go to court and say, you say April the 2nd.
No.
No, I just want to get a ballpark, to get some idea how long you've not been working.
Right.
And what was your job title?
Overhaul support mechanic.
And the only medicine to take is hydrocodone and Mobic, right?
Yes, sir. Just what they prescribed for me, as needed.
Okay, that's it. And past medical history, just a right knee injury. That's what I'm going to say. Right knee injury. You know, we can't go writing, he was 2 years old and he got cut on the knee.
Well, I mean, and the only reason I said that was because sports injury, you would typically think there might have been a sprain or.
You are correct.
That's what I'm saying. All it was a surface
I-
cut. It was not a sprain or anything else. That's what I want to make sure of. Just a
right knee
cut. Yeah.
Okay, I'll leave it at that. But nothing else, nothing major, no hospitalization.
Until I did this, I
Yeah.
could run with you. I could run with anybody.
Oh, I don't run very well, Chief.
Well, I could run.
I don't run very well. never.
Um,
All right.
Like I said, my biggest deal is I just wanted to make sure that I get a fair shake, because that guy, and I apologize, I'll be really brief.
Yeah.
Do you have his notes?
Yeah, I do.
Okay. And I'll be brief with what I do remember out of it, which was incorrect. He said patient can stand on his own feet or whatever, or something along those lines,
Okay.
but is afraid to fall or something. That was incorrect. I
Okay.
can't stand on it because, and in one of those, or Dr. Saunders, Dr. Craigson, he was actually right up the road up here
Okay.
on Davis.
Okay.
He said that the fascia or the tissue in between the tibia and the fibula was torn or whatever. But basically what I can tell you is those 3 ligaments that are down there, that he said delta or deltoid or whatever it's called.
Yeah.
But basically I can tell you that at Dr. John Novak's office, they have an x-ray of me not standing on it, me putting weight on it. Opens up what, so in other words, it's torn enough still that it causes a lot of pain. That's why I can't stand on the ankle.
Okay.
And that's why we're
It'll
going to
be
do the
good to
surgery.
see- It'll be good to see that actual doctor's notes, because I do understand what you're saying, but
I mean, you
it'll be
can,
good. Well, that's what I'm going to do.
yeah.
We're going to make a copy of those. So, but do you have any other questions that I can answer for you? Or? If you ask me a question I can't answer, I will simply say, I don't know. Remember, I'm just an evaluator. I do practice medicine. I do practice surgery.
Oh, I believe
But
you.
no, I'm just saying, but I can't give medical advice.
No, that's fine. I mean, because they're going to do what they're going to do anyways, and the insurance is only going to allow them to do what they say. So that, I understand that.
That may be, okay.
But I guess my
Yeah.
my main deal is, and the reason I was asking about the ankle or whatever
Yeah.
is because at this point in time, it's able to move this much.
Yes.
I know that what he said is because he's gonna have to take, he said it'll take 6
I'll help you with
weeks.
that immediately.
Yeah.
If you do have surgery, any kind of surgery, it is not unreasonable. In other words, reasonable to say you should have another evaluation.
Uh-huh.
So don't worry about that.
Right.
The key for you that I would worry about if I were you, is just try to get healthy.
Right,
The issue about evaluation, regimen, so on, impairment and all, those should be secondary to your own care. And that's what I would, if I were you, that's what you need to focus on, is trying to get care that you feel you need.
right.
And getting doctors who take good care of you.
Oh, for sure.
So that's what you, but well, would I get another evaluation? You might. I mean, you would, I don't know. I mean, I don't determine when to do an evaluation.
No, that's
The
fine.
system
That's fine.
determines that, and then they let me know, and then I evaluate. So
They actually sent me to you because the doctor that,
don't worry about why. Don't worry about. Don't worry.
no.
don't-
Well, that's what I'm saying. When you asked if I was gonna come back to you, they said he wasn't licensed to do what he was doing, so they sent me to you. So I would assume that they're gonna send me back to you. I was just wondering, and that's fine with me. I'll be glad. It's
Sure.
easy enough to get back over here.
All right.
And now, as far as the impairment rating or whatever,
Yeah.
that's what I was getting at. I mean, with the ankle being as it is, I can't stand on it. That's impairing
You're
my.
worrying about things too much. You're putting the cart before the horse.
Do you want me to tell you why I'm worrying about it?
I don't know.
Because I haven't been paid in 6 months.
Okay.
And because of what that man wrote,
Okay.
I haven't been paid in 6 months.
Okay, that's fair.
Now do you understand why I'm,
No, I do understand. That is fair. You're not being paid. That's reason. I understand. I need to be
okay,
paid.
now that's,
Well,
I'm not-
the key thing is I need to look at those notes.
no,
Because
I mean,
no,
they're,
and that's what I'm gonna do.
you
So
can,
before but before I do that, it would be unreasonable for you to make too many
no,
comments.
you make your decision. I'm letting you
Based
know
on
where
that, yeah.
I'm at.
No, and I see my
And then
facts.
that's why I brought all this stuff for you, because I want to show you,
So here's what we should do. I think to move forward is if you can get me those, and while we're copying them, you can fill out this paperwork in the waiting room,
absolutely.
and then so we can give your paperwork back. And that's your copy, right? That paperwork is your copy.
It is. And
Okay.
now you've got this, you've got the ankle, so I can put that
Yep.
over there. You do need,
But that big pile of paperwork, I don't think I have.
no, that's okay. You need this.
Yes.
This is mine right here. Do you want this? This is basically, I mean, I don't guess it really matters. This
If it's
is,
from a doctor, yes. If it's not, I don't need it.
it is from Dr. Chavda. He kind of went over it. He
Oh,
said
great.
that he hadn't seen the
Okay.
report.
Great, I make a copy of that too. Yep.
We're gonna do this so that I know where this goes. Put that over there. I just want to make sure, and like I said, that's why I brought all this stuff, because it's like, that guy really kind of, he screwed me.
I understand.
I don't know, this right here is this, you can look through it. I don't know if it's anything in there you need, or if this is just the post-op stuff, and it may be. Here, look at it real quick and see if it is.
Well, one we need to do something. I need to, it's the next guy. It's almost 4 o'clock.
Right,
I need to see the next guy.
okay. Well, I'm trying to make sure, I don't know if that's anything that I need, though.
What is all this paper? That's what I was wondering.
Well, that's all my medical records. I'm gonna give that to you to copy off anyways. So that's a given right there. You said you got the Churchill report right there?
I'll take a copy of that.
Do you need a copy of the Churchill report?
Sure.
That's the one you've already got. That was his MMI ruling.
Let me see. All right, here's what I'm going to do to be safe. I'll just copy this. How's that? And this and this and this.
And do you need any of the MRI stuff?
No, I'm just going to copy this because that's what I'll do.
Here. This is for the ankle surgery. You need that?
Did you actually see something in here?
He may. I don't know if he does or not. He can look through it real quick as you're copying off the other stuff.
What's the protocol? No, post-op instructions.
If you want his number, I can give it to you. You can
I just copy
Have
what
it
is that
faxed.
you're reading.
Okay.
All right. You want to come by because I got.
Yeah, it's unpacking everything up.
Yeah, if you don't mind.